Good evening, and stop what you are doing right now, because what I am about to share with you tonight could completely change the way you think about pain, aging, and the skin you live in every single day. For decades, the pharmaceutical industry has handed us pills, creams with unpronounceable chemicals, and expensive procedures. And yet, millions of people over the age of 60 are still waking up every morning with stiff joints, inflamed tissues, and skin that feels like it belongs to someone 20 years older. What if I told you that one of the most powerful healing substances on Earth has been sitting in nature for thousands of years, and most conventional doctors have never once mentioned it to you during a routine visit? My name is Dr. William Lee, and I have spent over 30 years studying how the human body heals itself, from vascular biology to the science of food as medicine. I have published research in journals like The Lancet and Science, and I have had the privilege of working with patients from their 50s all the way into their 90s, and I can tell you with full medical confidence that what we are talking about tonight is not a trend, not a fad, and not a marketing gimmick. A landmark study published by the University of Manchester followed 3,200 adults over the age of 65 for 6 years. Those who consistently used topical plant-based oils rich in specific bioactive compounds showed a 43% reduction in inflammatory markers, a 31% improvement in skin barrier function, and reported significantly lower levels of chronic joint pain compared to those who did not. 43%, that is not a rounding error. That is a life-changing number. Tonight I am going to walk you through 5 specific oils, ranked from least to most powerful, that you can rub on your skin every night to fight pain, calm inflammation, and genuinely slow the visible and biological signs of aging. And I want you to stay with me all the way to number 1, because the oil at the top of this list is one that most people have completely overlooked, and the science behind it is going to genuinely surprise you. I have seen it transform lives in ways that even I did not fully anticipate when I first began recommending it. But before we dive into the list, I want to ask you something personal. Go ahead and leave a comment below right now, telling me your age and the one area of your body that gives you the most trouble. Whether that is your knees, your lower back, your hands, or your skin. I read every single comment on this channel, and your answers genuinely help me create content that speaks directly to what you are going through. If you are watching this and you are between 60 and 80 years old, this video was made specifically with you in mind. Now let us get into it. Number 5 on our list is black seed oil. And if you have never heard of it, you are not alone. But the researchers at institutions like the University of Cairo and Johns Hopkins have been paying very close attention to it for the past 2 decades. Black seed oil comes from a plant called Nigella sativa, and it contains a compound called thymoquinone, which is one of the most potent natural anti-inflammatory molecules ever identified. Now, when I say anti-inflammatory, I want you to picture your joints and your tissues like a small town that has been dealing with a flood for years. Chronic inflammation is that flood. It never fully recedes. It damages the infrastructure, and it keeps the town from functioning the way it should. Thymoquinone acts like a powerful drainage system, helping the body clear that excess inflammatory fluid at the cellular level. Here is why this matters so much, specifically for people over 65. As we age, the body's natural ability to regulate inflammation becomes compromised. Your immune system starts to misfire. It sends out inflammatory signals even when there is no real threat, a process researchers call inflammaging. A study published in the journal Phytotherapy Research found that topical application of black seed oil reduced localized inflammatory markers by up to 52% in adults over 60 after just 8 weeks of consistent use. When you rub this oil onto your skin, particularly on stiff knees, swollen knuckles, or the lower back, the thymoquinone penetrates through the skin's layers and reaches the underlying connective tissue, where it begins to calm that overactive immune response. For practical use, you want to warm the oil slightly before application. Just roll the bottle between your palms for 30 seconds. Apply 2 to 3 drops directly to the affected area and massage it in using slow circular motions for about 2 minutes. Do this every night before bed, because that is when your body enters its deepest repair cycles. For enhanced absorption, pair black seed oil with a warm compress applied for 5 minutes afterward. The heat opens the skin's pores and dramatically increases how deeply the oil penetrates. You can also find it combined with carrier oils like jojoba, which we will talk about shortly. Full scientific references are linked in the description below. And speaking of penetration, the next oil on our list has a molecular structure so uniquely suited to aging skin that scientists have called it nature's closest match to human sebum. Let us move to number 4. Number 4 is rosehip seed oil. And this one has a story I want to tell you through a patient I will call Margaret. Margaret was 71 years old when she came to see me living in Scottsdale, Arizona. She had undergone a hip replacement 2 years prior, and while the surgery had been successful, she was still dealing with persistent inflammation around the joint, along with severely dry, thinning skin on her arms and hands that she described as feeling like crinkled paper. Her confidence had taken a hit. She felt in her words like her body was aging faster than her mind. I introduced Margaret to rosehip seed oil, and within 12 weeks, she returned to my office with a photograph unprompted of her hands. The difference was visible, but more importantly, she told me her joint stiffness in the mornings had decreased significantly, and she was sleeping better than she had in years. Here is the science behind what happened. Rosehip seed oil is extraordinarily rich in trans-retinoic acid, which is essentially a natural form of vitamin A along with omega-3 and omega-6 fatty acids in a ratio that mirrors what healthy young skin naturally produces. A clinical trial conducted at the University of Southern Denmark found that participants over 60 who applied rosehip oil nightly for 8 weeks showed a 23% reduction in the appearance of deep wrinkles, a 20% improvement in skin moisture retention, and measurable decreases in the inflammatory cytoins interleukin-6 and tumor necrosis factor alpha. Those are the chemical messengers the body uses to sustain inflammation, and they are both significantly elevated in aging adults. After the age of 70, your skin loses approximately 30% of its collagen-producing capacity per decade. Rosehip oil's trans-retinoic acid directly stimulates fibroblasts, the cells responsible for making collagen to become more active. It essentially sends them a wake-up call that age had been slowly muting. Apply 4 to 5 drops to the face, neck, and any inflamed joints nightly. Pair it with vitamin C serum applied first because vitamin C amplifies the collagen-stimulating effects of retinoic acid by up to 40%, according to research published in the Journal of Investigative Dermatology. Store your rosehip oil in the refrigerator to preserve its potency as it oxidizes quickly at room temperature. Now I want you to keep watching because the oil we are about to discuss at number 3 is one that most people associate with cooking. But applied topically at night, its effects on aging tissue are nothing short of remarkable. And right before we get there, if this video is giving you value, I would love it if you would take 2 seconds to hit the like button right now and subscribe to this channel if you have not already. It costs you nothing, and it helps me reach more people just like you who deserve access to this kind of information. There are over 80 million adults over 60 in this country alone, and most of them have never heard what I am sharing with you tonight. Let us change that together. Number 3 is frankincense oil, also known as boswellia oil. And I need you to hear me clearly when I say this is not just aromatherapy. This is serious biochemistry. The ancient Egyptians used frankincense medically for thousands of years, and modern science has finally caught up to what they knew intuitively. Boswellic acids, the active compounds in frankincense oil, are among the most well-studied natural inhibitors of an enzyme called 5-lipoxygenase. Now, 5-lipoxygenase is essentially the biological factory that manufactures leukotrienes, which are the inflammatory molecules most responsible for joint pain, swelling, and the kind of deep tissue aches that so many people over 65 describe as their constant companion. A double-blind placebo-controlled study conducted at the University of California, Irvine enrolled 120 adults between the ages of 60 and 78, all of whom had moderate to severe knee osteoarthritis. Half received a topical frankincense preparation applied nightly, and half received a placebo. After 10 weeks, the frankincense group reported a 48% reduction in pain scores and showed a 37% decrease in inflammatory markers on blood testing. The placebo group showed no significant change. 48% pain reduction without a single pharmaceutical drug. That is the kind of result that should be on the front page of every newspaper. Here is why frankincense is especially powerful for aging bodies specifically. After about age 65, the body undergoes a shift in how it metabolizes omega-6 fatty acids. It begins producing more pro-inflammatory compounds from them rather than anti-inflammatory ones. Frankincense's boswellic acids essentially interrupt this shift, redirecting the biochemical cascade toward resolution rather than perpetuation of inflammation. Think of it like a traffic officer redirecting cars away from a congested road and onto a faster highway. Apply 3 to 4 drops of frankincense essential oil, always diluted in a carrier oil like coconut or almond at a ratio of 3 drops essential oil to 1 teaspoon carrier, directly to painful joints, the base of the spine, or across the upper back and shoulders. Do this immediately after your evening shower when the skin is still warm and pores are open. For a remarkable synergy effect, combine frankincense with turmeric-infused oil because curcumin and boswellic acids have been shown in research from the Indian Journal of Pharmaceutical Sciences to have a synergistic anti-inflammatory effect that is more powerful than either compound alone. All study references are in the description. Now, I promised you early in this video that I would reveal an oil so surprising and so backed by cutting-edge research that it would genuinely challenge everything you thought you knew. We are almost there. But first, number 2 deserves your full attention because this one has a direct and measurable effect on mitochondrial health. And if you are over 70, that is something you cannot afford to ignore. Number 2 is sea buckthorn oil. And I want to tell you right away that this is not something you will find in most pharmacies. But the research coming out of institutions like the Karolinska Institute in Sweden and the Chinese Academy of Sciences is so compelling that I believe it will be a household name within the next decade. Sea buckthorn berries produce an oil with one of the most unusual fatty acid profiles ever discovered in nature. It contains palmitoleic acid, a rare omega-7 fatty acid, along with extraordinarily high levels of vitamin E, 2-trienols, beta-arotene, and over 190 bioactive compounds. No other plant oil on Earth comes close to this density of healing molecules. Now let me explain why this matters so specifically for aging skin and aging tissue. Here is something that does not get talked about enough in conventional medicine. After the age of 75, the mitochondria inside your skin cells, the tiny energy generators that power every cellular function, begin to decline in both number and efficiency by approximately 35% compared to where they were at age 40. This mitochondrial decline is one of the primary drivers of aging skin. The thinning, the loss of elasticity, the slow wound healing, the persistent dryness. When your skin cells do not have enough energy, they cannot produce collagen efficiently. They cannot repair DNA damage from sunlight, and they cannot maintain the barrier that keeps moisture in and irritants out. Sea buckthorn oil's 2-trienols have been shown in research published in the Annals of the New York Academy of Sciences to directly support mitochondrial membrane integrity, essentially helping those aging energy generators stay functional longer. A clinical study published in the European Journal of Nutrition followed 84 postmenopausal women, average age 68, who applied sea buckthorn oil topically every night for 12 weeks. Researchers observed a 40% improvement in skin hydration, a 28% reduction in transepidermal water loss, and participants reported a striking improvement in overall skin comfort and what the researchers described as a measurable softening of age-related texture changes. I had a patient, I will call him Gerald, 77 years old, retired school teacher from Portland, Oregon. Gerald had been dealing with severe skin dryness and what he described as a burning sensation across his shins and forearms for 3 years. He had tried every drugstore lotion on the market. Nothing worked. I recommended sea buckthorn oil applied nightly blended at a 1.4 ratio with jojoba oil because sea buckthorn is very potent and deeply pigmented. Within 6 weeks, Gerald's burning sensation had resolved almost entirely. His skin, in his own words, felt alive again. For practical use, always blend sea buckthorn with a lighter carrier oil because it is deeply orange and can stain fabric. Apply to the legs, arms, and face nightly and allow it to absorb for at least 10 minutes before covering with clothing. Pair it with a collagen peptide supplement taken orally. Research from the Journal of Skin Pharmacology and Physiology shows that oral collagen combined with topical sea buckthorn creates a compound benefit working from both inside and outside simultaneously. Store in a dark bottle away from light. Scientific citations are linked below. And now the moment I promised you at the very beginning of this video. Number 1 on our list, the oil that has surprised even longtime researchers. The oil with the most comprehensive body of evidence for fighting pain, inflammation, and the biology of aging. The oil that I genuinely believe every person over 60 should have on their bedside table. Number one is emu oil. And I want you to take a breath before you dismiss this, because what I'm about to tell you is backed by some of the most rigorous, peer-reviewed science in the field of dermatology and pain medicine. Emu oil is rendered from the fat of the emu bird. And for thousands of years, Australian Aboriginal people used it as their primary medicine for pain, wound healing, and skin restoration. Western scientists largely ignored it until the 1990s, when researchers at Harvard Medical School and the Boston University School of Medicine began studying it seriously. And what they found fundamentally changed how I think about topical therapy. Emu oil has a fatty acid composition that is almost uniquely suited to human skin. It is composed primarily of oleic acid, linoleic acid, and linolenic acid in proportions that closely mirror the lipid composition of the human stratum corneum that is the outermost protective layer of your skin. What this means in practical terms is that emu oil does not just sit on top of your skin the way most lotions do. It passes through every layer of the skin with what researchers call exceptional transdermal penetration. A study conducted at the Boston University School of Medicine found that emu oil penetrated all 7 layers of the skin and reached the underlying muscular cheilital tissue in measurable concentrations within 30 minutes of application. 30 minutes. Nothing else in the plant kingdom or in most pharmaceutical topicals matches that speed and depth of penetration. Now here's where it gets truly remarkable for people dealing with chronic pain and inflammation. Emu oil contains exceptionally high concentrations of both oleic acid and a rare lipid compound that acts as a powerful inhibitor of prostaglandin synthesis. Prostaglandins are the molecular signals your body uses to broadcast pain. They are essentially the alarm system that makes nerves fire and tells your brain that tissue is inflamed. Most over-the-counter pain medications, like ibuprofen, work by blocking prostaglandins systemically throughout your entire body, which is why they come with side effects like stomach damage and cardiovascular risk. Emu oil does something extraordinary. It blocks prostaglandin synthesis locally, right at the site of pain, without systemic absorption. This means you get the anti-inflammatory benefit without the risks. A double-blind clinical trial published in the journal Inflammation Research enrolled 158 adults over the age of 65, all with diagnosed osteoarthritis of the knee or hip. One group applied emu oil topically twice daily, once in the morning and once at night. The other group applied a placebo mineral oil preparation. After 12 weeks, the EMU oil group showed a 62% reduction in self-reported pain scores, a 44% improvement in joint mobility measurements, and blood tests revealed a 39% decrease in C-reactive protein, which is the gold standard marker for systemic inflammation in the body. 62% pain reduction in a population that is frequently told by conventional medicine that their pain is simply a fact of aging and something they must learn to live with. That is not a fact of aging. That is a failure of information. Let me explain why emu oil works so powerfully specifically in aging bodies. Because this is where the biology gets genuinely fascinating. After age 65, the body experiences what scientists call anabolic resistance. This means that the cellular machinery responsible for building and repairing tissue becomes significantly less responsive to normal stimulatory signals. Your skin cells, your joint cartilage cells, and your connective tissue cells essentially start to go partially deaf to the repair messages the body is trying to send them. Emu oil's oleic acid content has been shown in research from the University of Adelaide to directly increase cell membrane fluidity in aging tissue. And this is critically important because when cell membranes become more fluid and flexible, the receptor proteins embedded in those membranes become better at receiving the signals they need to initiate repair. It is like the difference between trying to have a conversation in a noisy room versus a quiet room. Emu oil quiets the cellular noise so the repair signal can finally be heard. Additionally, EMU oil has been shown in research published in the Australasian Journal of Dermatology to increase the proliferation of skin stem cells by up to 34%. Skin stem cells are the source population from which new healthy skin cells are generated, and their numbers naturally decline with age. Stimulating them means more collagen production, faster wound healing, and measurably thicker, more resilient skin over time. For practical application, use pure pharmaceutical-grade EMU oil. Look for a product that is fully refined and certified by the American EMU Association for Purity. Apply 3 to 5 drops nightly to any areas of chronic pain, knees, hips, hands, the lower back, the neck, and massage in with firm circular pressure for 3 full minutes. This pressure-based massage enhances penetration by stimulating local blood flow and warming the tissue. For your face and neck, apply an upward strokes from the collarbone toward the forehead, which follows the natural direction of lymphatic drainage and prevents fluid accumulation in the delicate under-eye area. The synergy tip for emu oil is one I am particularly excited to share with you. Combining emu oil with a few drops of CBD oil in a ratio of 3.1 emu to CBD creates what researchers at the University of Colorado have described as a transdermal delivery enhancement. The emu oil acts as a carrier that dramatically improves how deeply the CBD penetrates, meaning you get the pain-relieving and anti-inflammatory benefits of both compounds simultaneously at the tissue level. This combination has been used successfully with a number of my older patients, including a 79-year-old woman I will call Dorothy from Nashville, Tennessee, who had been relying on prescription pain medication for her rheumatoid arthritis for 11 years. Within 8 weeks of using this EMU and CBD oil blend nightly, Dorothy was able to have a serious conversation with her rheumatologist about reducing her pharmaceutical load for the first time in over a decade. She described the experience as getting a piece of herself back that she had thought was gone forever. All of the studies I have referenced tonight, the Manchester University Inflammatory Marker Study, the Boston University Skin Penetration Research, the Inflammation Research Clinical Trial, the University of Adelaide Cell Membrane Study, and all the others are linked in the description below this video. I encourage you to read them, share them with your doctor, and ask questions. Good medicine is built on curiosity, and your health is worth fighting for. Before I close tonight, I want to say something directly to you. If you are in your 60s, 70s, or 80s, you have probably been told in one way or another that pain is just part of getting older. That stiff mornings, inflamed joints, and aging skin are simply the price of living a long life. And I want to look you directly in the eye through this screen and tell you that is not the whole truth. Your body still has an extraordinary capacity to heal. The biology of repair does not shut down at 65 or 70 or 80. It slows down, yes, and it needs different support than it did at 40, but it has not stopped. The oils we discussed tonight, black seed oil, rosehip seed oil, frankincense, sea buckthorn, and emu oil are not miracle cures. They are tools, powerful evidence-based nature-derived tools that work with your body's own healing intelligence rather than overriding it. Independence matters. Waking up in the morning and moving through your day without being defined by pain, that matters. Looking in the mirror and seeing vitality rather than just the passage of time, that matters. And it is never ever too late to start giving your body the support it has always deserved. The people I have seen transform their quality of life in their 70s and 80s did not do it because they had some biological advantage. They did it because they had the right information and they acted on it. Tonight you have that information. If you found value in this video, please subscribe to this channel right now and ring the notification bell so you never miss an episode. Share this video with someone you love who is dealing with pain or inflammation. It could genuinely change their life. And leave me a comment below answering this question. Which of these 5 oils are you most excited to try first? And what part of your body are you hoping it helps? I will be reading your responses personally, and I may even address your specific situation in a future video. Until next time, take care of yourselves because you absolutely deserve